What's up, Jacob? What's going on? Doing well. What can I do for you, Jacob? Today's a busy day. Just finished up. We had 2 surgeries this morning. Both were angiograms. One of them we ended up doing a tibial atherectomy, and the other ended up being an SFA, popliteal, and tibial treatment. Then I just swung by the hospital, saw 2 consults, and now we're about to head home and call it a day. What have you been up to, man? How's your studying? Is there anything I can do to help you out, my dude? Good. Glad to hear that. What are you studying for right now? Yeah, for our different levels of service, it depends. So what we actually do is we set up a call with me personally prior to you being able to join. So there's no way to join my program without actually doing an actual interview with me. And so the interview, what it is it's basically a structured format that emulates a residency interview. And so on these interviews, essentially, I'll ask you similar questions, just kind of get to know you and also see where you're at exactly with your preparation. So for example, if you're an M1, it's going to be a bit of a different conversation than if you're an M3 and vice versa. And so it really depends on how much help and support that you need. We have 3 different levels of support, but that's going to depend on where you're at in the journey. So definitely, I highly recommend it. Just go to actionpotentialmentoring.com. And then, oh, perfect, you're a graduate, so even better. And we can dive into the details for each one of those programs on the call. So basically, how I like to think about it is each one of the programs is going to have access to the app that I built. You're going to get access to our study strategies, our protocols, the content, and the difference between the levels of the programs is how much help and assistance you need. So for example, the VIP Mastermind, you're working with me directly. You get unlimited access to me. You can set up Zoom calls, phone calls, even an in-person rotation with me if you'd like to. The Accelerator program, you're going to still have messaging access to me, but you don't have unlimited Zoom calls with me. You have a once a week
There are police
small
reported
group, and we can hop on a Zoom 1 time per week with that program. And it's going to be a small group session. And then lastly, the up-level program is working directly with one of my coaches. So it's somebody that has actually went through my program and been super successful for their specific specialty. So let's chat a little bit more about it. Check out our website, actionpotentialmentoring.com. And then if you just follow through the prompts, it'll say, hey, do you want a free training? Click yes. You can select the free training. And then after that, it'll take you to a page to register for the call. So you submit some information about yourself, such as kind of like your resources you've used to study previously, whether it's UWorld or First Aid or whatever it is. Give me a little bit of background on you, and then we'll hop on a call. And so you can actually get my personal calendar through our website to be able to register for a time slot on there. And it's me that you speak to directly. So you literally book the call with me and we'll chat about your specific situation and see if we can help you out. And we turn down about 65% of people that book calls with me, simply because if I don't think you're a good fit, I'm not going to offer you a position in my program. Because at the end of the day, I mean, it's got to be worth it for both of us. It's got to be something that I feel that you're coachable, you're hardworking, and it's going to be enjoyable to work together. So that's kind of the long and short of it. Let's see, Ahmed Shahid, he said, being an IMG with no connections, what do you think? I mean, I believe it's more like mindset along with hard work. How do people with 270 plus think and what they basically do? Thank you. That's a great question, man. So over the last 7 years, I've worked with over 2,100 medical students, and obviously there's a pretty broad variety, whether they're IMGs, whether they're MDs, DOs, and over the last 7 years of doing this, I've had students hit in the 270s every single year. And so obviously it's not a coincidence at this point. There's strategies and protocols that can and should be implemented to make sure that you're doing whatever it takes to ensure your score is where it needs to be. And so think of the med school game essentially as a big game of chess. Okay, so think of it as, what's the strategy that you need to implement in order to make sure that you can checkmate your opponent, which is the USMLE. And so if you just went against a chess grandmaster, then no matter how lucky you are, you're not going to win. And it's the same thing with the USMLE. It's all strategy. And so we actually built into our coaching program a specific section that is all about self-improvement and mindset, simply because so many medical students struggle with that, whether it's from anxiety with test taking, whether it's with motivation, whether it's with focus. We target each one of these things in our modules inside the program because it's an area that's a super easy leverage point. And what that means is the people that score 270s think like people that score 270s, and the people that struggle to pass obviously think like people that struggle to pass. And so if you can change your inner monologue, your inner operating system of how you think and how you process and how that you basically systematically go through your practice questions, through your journey, through your research, through your ERAS, through every single aspect of your journey, you can make a huge impact on your trajectory. And so like I've had students that go up over 72 points in 3 months. That's almost a point per day. I've had students that go up over 30 points in 1 month. That's over a point per day. So you can make huge jumps in your performance. And obviously if you come to me and you're scoring at 200 and we have 3 months and you go up 72 points in the next 3 months, that puts you right in the 270 range. So there's a method to the madness. Every single aspect of the journey can be improved and should be improved, but it's up to you to take the action to get the help on it. And that's something that I had struggled with early on. So I didn't know how to study perfectly whenever I first started this journey. In fact, I struggled a lot and I didn't do well on my medical school admissions test. I was bottom quartile on it. And I found that with better ways, better methodologies, that there's a huge opportunity to improve your study performance. And so I teach you the reverse pyramid protocol, the Fibonacci learning acceleration, scaled repeatability, UAMP learning protocols, everything that you need to know to make sure that your studying is as linearly progressive as humanly possible. And so, like you kind of alluded to in your question, the mindset is really what matters. It makes a huge difference. And that's what I teach you. I teach you not just the mindset, but also the step-by-step protocols to actually implement that. If you want to hop on a call to discuss your specific situation, I highly recommend it. It's www.actionpotentialmentoring.com. You can go through our site, get a free training, and then book a call with me. Let me know. We'd be happy to help you. What else can I do for you guys? Any specific situational questions, anything I can advise you on, anything that I can help out with, let me know. I'm happy to answer any questions. I'm an open book. So if you have questions about studying, questions about your preparation, questions about rotations, questions about getting research, about interview prep, whatever it is, let me know. Have a good day, Jacob. Glad you could hop on for a minute. All right, question here. I work full-time. What do you think is the best way to prep? It's hard to say without knowing your exact situation, but I can say that if you're working a job that's mentally fatiguing, so let's say that you're a medical assistant or a scribe or something that requires you to be pretty focused for a lot of your day, I highly, highly recommend actually going to bed extremely early, like I'm talking like 8 p.m., and then waking up around 3 or 4 in the morning and getting your studying done before you go to work. And it sounds a little bit contrarian, but trust me, I mean, after working with over 2,000 medical students, the thing that I found that works best is studying the most important thing when you're fresh. Because when you go home, you aren't gonna feel like doing crap if you just did a 10 or 12-hour shift. And that includes your driving, your lunch break, your shift at the hospital or the clinic or whatever job you have. And so get your studying done first, and it will change the game for you. And so whenever I create study plans for students, what I actually do is I have you on the onboarding, I have you send me your availability. So the hours that you work, the hours of your job, the times that you're available, your sleep wake cycle, your sleep chronotype, everything. So I need all this information so that when we build your plan, it takes all that into account. And so that's definitely where I would start with that question for sure. Ahmed says, does your program offer observership? Yeah, absolutely. So our VIP Mastermind program, if you check out our website at actionpotentialmentoring.com, you'll see that one of the perks for it is that you can actually do a rotation with me. And so you can do, we have kind of 3 different settings that you're able to rotate with me with. And so number 1, we have clinic. Obviously, you can tag along for clinic, see some patients, learn how to do vascular ultrasounds. I'll teach you how to do that while you're here. Super useful skill regardless of what specialty you go to. I mean, you can learn how to check somebody quickly for DVTs in under a minute or 2. You can look for arterial occlusions, look at somebody for carotid stenosis, all kinds of things. So that's clinic. And then we also have what's called an OBL. It's an office-based lab. And essentially you should think of it as like a mini surgical center that's inside of our office. And so we can actually do a lot of procedures inside of our office and allow patients to go home the same day. That's one of the beauties of vascular surgery, is it's maximally invasive, but also has a minimally invasive component. And so like today, for example, we did 2 procedures inside of our OBL. We did 2 angiograms for people that had chronic limb-threatening ischemia. We're able to restore the flow, and they went home same day, maybe 2 hours after the surgery. So it's something really cool. You'd be able to scrub in, you'd be able to get in there, in on the action, learn how to do kind of all the basics, not just for scrubbing in, but also how to actually evaluate angiograms, how to actually learn the best treatment protocols for it. And it's really cool. So that's something that's included. And then also the third avenue for you to be able to rotate with me would be in the hospitals. So that does require a little bit more paperwork. It's something that we have to clear through the hospitals, and it's not usually too much of an issue. We have a student right now that's rotating with us and scrubbing in on surgeries in the hospital, and it wasn't hard at all to get him approved. But basically what we do is my partner and I, we cover, I want to say somewhere ballpark like 11 different hospitals down here in the South Florida area. And so I have what's called privileges at each of these hospitals. And so if I get called for a consult, like right now, I'm leaving from a hospital where I got 2 consults from the podiatry service with people with foot wounds that needed revascularization. And so I went and saw the patient, and then tomorrow we're gonna actually take one of the patients to the operating room. So it's a quick turnaround like that oftentimes, and it's because we have privileges at all these different hospitals. And so what we would have you do is just basically get an observership privilege so that you'd be able to come along with me to the different hospitals and be able to scrub into those surgeries as well. So you kind of get a 3-for-1. It's cool. So it's clinic, it's the OBL, and then hospital based as well. Let's see, Jacob said, for most of your bypass grafting, do you harvest the veins yourself or abusing assistant does it for you? No, I do it myself, man. I do it myself. So we just did a FEM-PT bypass with reverse greater saphenous vein maybe like, I want to say 2 weeks ago. I harvested the vein myself. What other questions do you guys got? Almost home here. This Miami traffic is killer. I mean, I probably drove like almost 2 hours today back and forth because I had to cover so many different places today. But it's all good. It's part of it, you know? Like, especially whenever you have patients spread all about the city, sometimes it's better to just get your rounds done super early in the morning if possible. But today I chose to hit the gym instead of going to the hospital early on. So now I'm paying for it with the traffic. Let's see, it looks like Jacob did a subclavian femoral bypass grafting recently. Wow, that's awesome. That's quite a bypass. Usually people do ax-fem bypasses rather than from the subclavian, but it just depends on where your proximal anastomosis comes off of. But it's a good case. Not ideal patency, but sometimes that's all you got, you know? If somebody doesn't have other good options, maybe they don't tolerate an aorta bifemoral bypass, or maybe they're not a candidate for iliac stenting or whatever it may be, then you might have to come off the axillary artery. But it all depends on each patient's anatomy. That's one of the cool things of vascular surgery, is there's no one size fits all for it. So a lot of patients' disease patterns is going to actually be what dictates your treatment protocol, you know? So if somebody's really sick and they have heart failure and COPD on home oxygen, obviously certain options such as a aorta bifemoral bypass might be a lot harder for the patient to tolerate, rather than some sort of a common femoral end dart, which pretty much anybody can make it through that, you know. And then especially some aorta iliac stenting, like most patients are going to be able to survive that procedure with relatively low risks of hemodynamic compromise due to the procedure. So just got to know your patient. That's why you got to see everybody around on them, make sure that you get a good history, establish rapport with the family so they can tell you if this is the patient's baseline as well, especially if they have altered mental status or they're intubated or some other factor precludes you from getting the history from the patient themselves. But yeah, it's cool. If any of you guys have any questions, if you want to come check out some vascular surgery in South Florida, let me know. Check out our site at actionpotentialmentoring.com. And I'm just about home here, so unless you guys have any other questions, we're gonna call it an end to this live session. Appreciate you hopping on here. It's good chatting with y'all. Oh, we got one last question here. Applying to EM, any thoughts on residency CAS? What questions do you have about it? Is it about the format of it? Is it about what's included or what you need to put on there? How to write your experiences up? What exactly is your question? I got a lot of thoughts on it. It just depends on what your exact question is. What are your thoughts on IM? I mean, if you like it, then it's the way to go. There's nothing wrong with internal medicine. It's a great specialty, and it definitely keeps the hospital going around, you know, whether you want to do kind of like hospitalist shift work or whether you want to subspecialize. There's a ton of options with internal medicine, and that's something that really is great, you know, keeps all of your doors wide open for you. And that's like really what it's all about. If you're undecided on your journey and you don't know exactly where you want to take your application, whether it's to cardiology or to GI or to hem-onc or infectious disease or whatever it may be, then internal medicine's awesome in that regard, because it keeps all your doors open and you're still getting a great training program. And so I definitely think that for people that are interested in that, or if you just like the hospitalist lifestyle and the process of managing a list full of patients and basically being the person that's the quarterback of all of it. Phone's here. I'll walk back in. You can't hear me. Let's see. So AK said it's glitching, everyone's panicking. If it's glitching, what's that gonna mean? You know, like, it's glitching for you, it's glitching for everybody. So don't let stuff like that get inside your head. That's important, you know. Fact of the matter is that there's glitches in these softwares every single year, and I don't know how that's even possible in the year 2025, but there's glitches every single year, whether it's residency cast for whether it's ERAS, whatever it is, there's always glitches in these softwares. I'm on, absolutely, man. Thank you for hopping on. It's my pleasure. Let me know if you guys enjoyed this, just hopping on and kind of doing an impromptu chat like this. I'm always happy to do it, especially if traffic's bad and I know I'm going to be in the car for a minute. Yeah, Jake, absolutely, man. Appreciate you hopping on. Does anybody else have any questions? If you guys do, I'll stick around. I'll chat some more while I walk our dog. Let me know. Any other questions, guys? As that said, how much do you bench? So right now, probably honestly, if I had to max out, I'd be lucky to push up about 245 or 255. I haven't trained max in a while. Back in undergrad, I was doing 295 for two. Right now, nowhere near that, just because I don't train as heavy anymore because I don't usually have a spotting partner. If I go to the gym, I'll go with my fiance, but we usually do more of interval training and stuff like that nowadays. Um, Back in college, I was a high jumper, so I trained legs primarily for the track team. I did 365 for 14 was the most I ever squatted. Deadlift, the most I ever did was 475 for two, I want to say. Either 475 or 495 for two. I think it was 475. But yeah, I mean, with residency and now obviously being an attending, you can't recover from those type of workouts as well as you used to back in the day. It's tough. Definitely the sleep deprivation gets you. Your joints start hurting you. I like that. What other questions do you guys have? Hola, Chuy. All right, Jacob, booking a Zoom call with me soon. Perfect, man. Dude, anytime that you want to just chat about your situation and see if there's anything we can do to help you, just book a Zoom call. I mean, what's the worst thing that can happen is I get you some free advice on what to do better, you know? Happy to help you guys. I'm going to walk my dog while we chat a little bit longer. Chewy, come on. Come on. Good boy. Good boy. There's Chewy. Ready for action. All right, vamos. Let's go, buddy. I'm still staying at the hotel right now. I got a 6-month lease at the hotel. It's great. It's the free room service, the free maid service, free Wi-Fi, free parking. It's good. Can't beat it so far. My fiance and I are still looking for a house down here, but of course the Miami housing market is crazy. It's absolutely out of control. So once the interest rates come down, we'll probably pull the trigger on something. All right. As that said, do you like your work-life balance? Yo, I'm gonna be honest, it's freaking awesome. It is absolutely awesome. And let me just give you guys some insight here because this is something that nobody, like legit, nobody told me this on my journey. That your residency training, but what they don't, everybody knows that. Your life as an attending is exactly what you make out of it. Okay. Now, with that being said, I have actually opted to take some calls, especially in the beginning, just to get my patient load up and so that I can kind of get my name out there more. And it's not been bad. I've had to go in exactly one time overnight to operate in the last 4 weeks. And it was because it was a patient that emergently needed it. But aside from that, I've not even been woken up once at night since I started. And so